my name is Amanda Garnett, and I'm a physical therapist with OrthoVirginia, and welcome to our Facebook Live. For those who might not know OrthoVirginia, we are the largest multi-specialty practice in Virginia. We have locations in Richmond, which is where I practice, Northern Virginia, Lynchburg, Southwest Virginia, as well as Virginia Beach. Now, I don't want to take up your time telling you about us, but if you would like more information on OrthoVirginia, please go to our website at www.orthovirginia.com. Today, I'm going to be discussing the importance of foot and ankle strengthening as it relates with athletes. This is a topic very near and dear to me, as I have been a runner for many years, and after a hard training season, I sustained an ankle injury several years ago. This experience and helping rehab through this experience helped shape my passion for working with athletes of all ages. It also helped me really appreciate how important foot and ankle strengthening is for athletes. Now, before we get into more about the foot and ankle, let's not forget about your friends. If you have any friends or family that you think would be interested in today's topic, please feel free to use the share button below and share it with them. Today, I'm going to start off with a very brief glimpse into the anatomy of the foot and ankle, as we will reference it in several different ways today. I've got a model here for a little context. Starting with the two big bones in the lower leg, come down to form the malleoli of the upper ankle. We have a syndesmosis in between. Looking from a side view here of the foot, we've got the rear foot, which includes that calcaneus, which is where that Achilles tendon that we hear so often attaches. We will come back to that Achilles shortly. Coming down, we have the midfoot, followed by the forefoot. We use the forefoot a lot for those propulsive forces during our athletic activities. In addition to the bones and joints within the foot and ankle, we have over 20 muscles, numerous ligaments, as well as the plantar fascia in the bottom of the foot. All of these have to work together to provide us that fundamental stability, as well as strength for those push-off motions during our athletic activities. Today, I'm going to put this into the context of for athletes, and I'm going to discuss the importance of mobility, stability, and strength within the foot and ankle. So first, let's discuss mobility. While there are many motions within the foot and ankle, I'm going to focus today on two that are particularly important for athletes. I'm going to grab my model again. The first would be the motion in the front of the ankle that brings your toes towards your nose, or what we reference as called dorsiflexion motion. The second motion that's particularly important for athletes is motion at the big toe. When you think about sports that involve running, the lower leg has to roll over the foot and ankle. In order to do this, we have to have good mobility in the front of the ankle in that dorsiflexion movement, as well as good mobility in the big toe for push-off. You have to have mobility in the toe itself, as well as not a whole lot of tension within that plantar fascia to continue to propel you forward during your activity. So next, let's move on to ankle stability. One of the big key differences between sports that involve walking and running is that during running, there's never a phase in which both feet are on the ground at the same time. So when you think about that, running is truly a single leg sport. In order to do that, we have to have that good foundational foot and ankle stability, as without it, we can compensate up the kinetic chain using altered movements, which could then lead to injury. So working on some single leg stability and strengthening exercises can not only influence positively good ankle strength and stability, but it can also help protect and condition the muscles up the kinetic chain. This leads us into good strengthening for the ankle and foot. No foot and ankle talk is complete without discussion of the calf and the Achilles complex. When we're discussing the calf and the Achilles, I want to go back to anatomy just a little bit, talking about two big calf muscles, one that starts up here called your gastrocnemius, and another that starts here called your soleus. They both come down to form that Achilles tendon, which inserts back onto that calcaneus bone. So, with regards to the Achilles tendon, it is truly the largest and strongest tendon within our body, as it can withstand up to 12 times the force that of body weight while running. Needless to say, it's pretty important to keep it happy so that athletes are able to use that strength and power to their advantage. The Achilles is also a big spring. So we are able to use some of that stored elastic energy within that big tendon as to continue to propel us forward with less energy or less effort and stress. Going back a little bit to the musculature about the calf, one of the biggest muscles in the calf that comes up about halfway that I mentioned earlier is your soleus muscle. So that Achilles tendon originates up within the soleus, and the soleus is used more when the knee is bent. So in that regard, we typically run with a soft knee, thus the soleus is used more. So not only is it very important thinking about its relation to the Achilles where it originates, but also it is often regarded as the powerhouse for endurance athletes. Thus, it's very important to keep this muscle both strong and limber. So now I'd like to go through a couple tips and tricks to help you better assess your ankle mobility, stability, and strength. As I mentioned earlier, there's so many different ways that we can focus on mobility, but I'd like to focus on two different ways that you can assess those two motions that we mentioned earlier. The first would be the ankle mobility test at the wall. Today I'm just going to use this so you can just better assess here. I would start with your big toe right against the wall, trying to keep your heel down. Try to touch your knee to the wall. As you do this, try to assess, do you have any stiffness in the front of the ankle? If you do, you can then use this test as an exercise, trying to keep the heel down, gently tapping, using your body weight to gently glide the motion in the front of the ankle joint. As this gets easy, you can then scoot your heel back about an inch at a time, and same thing, working to try to touch your knee to the wall. I would repeat this on both sides, and you can focus maybe between 10 and 20 taps at each point to really work on that mobility in front of both. The next ankle mobility test is going to be in regards to that great toe motion. So to spare you, I'm going to keep my shoes on, but today I'm just going to show you with the foot joint. So if say your foot is on the ground, take your shoe off and allow the rest of the four toes to rest naturally on the floor. Using your hand, I want you to try to test the mobility at that big toe joint and see, do you feel any tightness there, or are the other toes trying to come up as well? If you do feel any tension there or under the foot, what I would advise, try not to get this rolling everywhere, to use either a tennis ball, lacrosse ball, or frozen water bottle, and simply place that under your foot on the ground and use that to gently roll out that stiffness throughout that arch. I would spend 3 to 5 minutes at a time and not going to pain, just to gently release some of that tension. In addition to having really good mobility, it's important also to have good ankle stability, working on our foundational strength. One of the easiest ways that you can test for this would be standing on one leg. I often advise my athletes to do this in front of a mirror. That way you're a bit better able to visualize what your body is doing in space. So start just by standing on one leg. Then start looking at the ankle. Is your ankle wobbling back and forth? Or does it stay nice and stable? Coming up to the knee. Does the knee stay nice and stable, thinking about it as a headlight? Or is it trying to veer to the side? And then I would come up one step further, looking at your core and your hips. Are your hips dipping on either side, or are they staying nice and strong? If you answered yes to any of these questions, you can then use this test as an exercise. So same thing, I would stand in front of your mirror, I would stand nice and tall. I often emphasize to clients to press through your heel to engage those good posture muscles and try to stand there for 10 to 20 seconds at a time. And of course, assessing both legs. I would start with 3 to 4 times, holding 10 seconds on each leg. If you want to take this to the next level, especially say if your sport was more endurance-based, I would work on your single leg control out of your base of support. So going back to my good friend here, the foam roller, we're just going to say this is a cup on your kitchen counter. you can start a few inches back from the counter and start with that same good position, pressing through your heel, engaging those good posture muscles. Reach out in front of you to tap the cup, squeeze the back of the muscles in the leg to help come back up to standing. And again, nice control, slowly back up. So not only is this great for single leg strengthening at the ankle, but it's also strengthening some of the muscles up the posterior chain, which provide us those good endurance muscles and help protect against injury. This leads us into some tips and tricks to help with strengthening. As I mentioned earlier, no foot and ankle talk is complete without talking about the importance of strengthening the calf complex. Today, I'm going to put a little spin on it because I really want to focus on that soleus muscle that I mentioned earlier, which is the powerhouse for endurance-based athletes. So I would start with a simple heel raise, but I'd like you to start with your knees nice and soft, as again, the soleus is used the most when your knees are bent. You can hold on to something as needed for stability. That way you are just able to focus on the control. Starting with your feet about hip width apart, controlling up 2 to 3 inches, not going for a full stiletto here, and control slowly back down. Most important here, not going up too high, but focusing on the control in the up and controlling 2 to 3 seconds to roll back down onto your feet. That should feel pretty easy, so I would start with 15 to 20 reps. And then as that gets easy, you could progress to 2 to 3 sets at a time. I would like to progress this one step further, again, really combining both that single leg strength as well as progressing that soleus and Achilles strengthening. So again, you can hold on as you need to. This is what I like to call, is what is called an eccentric heel raise. So you're starting in the same position. Knees are soft to target the soleus, coming up on both toes, shifting your weight onto one, coming down slowly on one. So up 2, down 1. Really focusing on that 2 to 3 second control to roll back down onto the ground. This one should feel more fatiguing, but it is beneficial not only for strengthening for the calf, but it also works on the Achilles loading and works by lengthening, which is a really positive strengthening aspect. Both of these can be progressed one step further if they get easy with your feet on the ground. You could stand next to your stairs, have the balls of your feet on the ground, the balls of your feet on the step, and then work, but still on the up, but letting your heels sink past the height of the step. I would start with a very slow and controlled motion as you do that, not going all the way down at first, just your point of control. And most importantly, with that one, I want to make sure that you would never go to the point of pain. So you can always start both exercises, maybe with 10 to 15 reps, and then work your way up to 2 to 3 sets at a time. And again, not for speed, but really taking that 2 to 3 seconds for control. So starting with each of those, I hope that kind of gives you a good glimpse into both the ankle mobility, stability, and strengthening aspects. I hope you find this information and tips helpful, and I really appreciate y'all having me here today. As with anything, I think it's most important to reach out to your orthopedic care team about your situation. One of the easiest tools, if you're an OrthoVirginia patient or client, is using the MyChart, and that way you are able to have good communication with your care team. Again, thank you so much for having me, and I'm here for any questions you may have.
Thank you, Amanda. That was fantastic. Let's see. We have the first question that comes in. Could you address any special considerations for an adolescent athlete who is very flat-footed?
Yes, indeed. That is. And so when you say adolescent, that brings up a couple different things to mind. I guess in one regard, you have to think about the athlete still growing. You have to think about, okay, well, I don't want to do anything too crazy. Make sure that it's not, of course, the foot shape can always change. With being more flat-footed, of course, I think it's important to, again, work on their good mobility, as we discussed earlier. They may be more prone to some arch discomfort in that bottom of the foot. So when I was talking earlier about using good old lacrosse ball and rolling the bottom of the foot, or tennis ball, just something nice and light, and perhaps doing that after activity, just to make sure that it stays nice and loose, and of course not going to painful. And then of course you can always reach out to your physician, but they may suggest either like an over-the-counter orthotic. There are a couple brands that we use, but especially for those that may be more flat-footed, we could use either Arch Rivals or Power Steps. But again, I would really reach out with your orthopedic care team to see if you can manage it in other ways first, as they're still growing and not wanting to put anything too permanent in the shoe at first.
Great, thank you. Another question is coming in is it not normal to go up on my toes after Achilles surgery?
Yes. So very, and I hope you're doing okay after your Achilles surgery. That is a hard thing to go through. But so when you think about it, the main function of the calf and the Achilles is what is the opposite of the motion that we were talking about earlier, dorsiflexion. It's called plantar flexion. And that's actually a test we use when someone has ruptured their Achilles, is can they point their foot, or when we squeeze the calf, does it point? And if it doesn't, that usually means there's an issue. But so thinking about, it's going to take several weeks for that muscle engagement to come back. Usually what I would start, of course, definitely check with your physician to make, each physician, especially with regards to the Achilles, likely has their own Achilles protocol, meaning during your rehabilitation process that there going to be several steps to make sure that you're not going too fast too soon. So definitely check with your care team about when it's appropriate to start working on that. Usually we would start patients, of course, just actively trying to move that foot in that pointing down position, then going against resistance in a band, and then even just progressing to a seated heel raise. As, of course, the more body weight that you are putting on it, the more weight you're having to put on the tendon and asking it to perform against. So again, check with your physician depending on the stage that you're in, but if he or she allows it, to start working into that resistance with a resistance band. And I would start with going into a seated heel raise, and then you can progress that, kind of like I was saying when we were talking about the standing heel raises and the eccentrics. You can start with 10 to 20 reps, and as that gets easier, progress a couple sets. And then you can check with your care team, and especially your physical therapist, about when it's appropriate to start working on that standing once you have enough of that foundational strength there.
Perfect. Our next question is, what exercises can I do for arthritis in my second TMT joint in my foot?
Very good. So let's get our big model here. So the second TMT up here. So of course, big toe, second toe here. So that is also used, that joint is also used a lot for push off. So this is going to sound funny, but a couple different ways to strengthen what we call the midfoot and the forefoot is something that we call toe yoga. So you can sit with your foot on the floor and try to control taking your toes up, spread them out, and try to really slowly control them down. So again, I know this is going to sound a little wonky, but just really working on the muscles in between all of the joints within the foot, in the forefoot, and in the midfoot. So again, still taking the toe, keeping the rest of the foot down, taking the toes up, spread them out, try to slowly control them down. You can also work on the opposite direction, would be kind of bending the toes. So you could sit in the chair, have a towel under your foot, and scrunch it. And you can kind of move the foot and ankle in different positions, and you can do that for 2 to 3 minutes at a time. You'll be surprised how fatiguing it actually is.
Real quick, could you go back and say, when you were talking about the insole brands, I believe it was Arch Rival and another one?
Power Steps.
Power Steps. Okay, perfect. Thank you. The next question is, what are the best, and I hope I say this correctly, what are the best exercises for syndesmosis ligament ankle repair for high school age, getting back to the mound for baseball pitching?
Ooh, That's awesome. So it sounds like what they had, one of our foot and ankle physicians does that surgery here. So they may have had the tightrope procedure, which is really neat. If y'all remember, if any of y'all were football fans, a couple years ago, there was a Alabama football player that had the tightrope surgery to help that upper ankle and syndesmosis stability. So when you think about that, I'm sure this athlete is getting their motion back. I'm sure that's getting good strength, but they're likely still dealing with a good amount of swelling post-operatively. Very, very normal, just unfortunately with the foot and ankle, just gravity dependent. There's nowhere for the swelling to go. So that's a couple different answers for that. First, I would really make sure that they have that good mobility here. And you said it was a pitcher, correct?
Correct, yes.
Did it say which hand pitcher?
Does not know.
Okay. So, all right. And so again, I would first make sure that the ankle joint is nice and mobile in the front, but then kind of thinking about, let's move this back just a hair. Let's say they're a right-handed pitcher. So they're going to have to come up, having to stand on that leg, and then kind of go through the motion, and eventually like that. And I'm sure that was horrible for them. But really thinking about that, it would be very, very good to work on that single leg stability. So, and they could even start just holding the ball, standing on that leg, and even practicing some of that pitching motion at first in this plane. So starting just really easy here, start working on that pitching motion, maybe 10, 20 seconds at a time. But then I would also work on some of that rotation. So especially that leg, if you think about it, that leg is going to have to transfer weight across your body. So you could use that exercise we were talking about earlier, but I would combine it twofold. Good thing I have that. I would start working on that good stability here, reach to one, but then have to reach across their body as well. So if you think about it, that's that similar rotation. So using the opposite hand to one, opposite hand to the other. And that way you could do, and so starting in close, maybe 5 to 10 inches away at first. As that gets easy, step back, because then they're going to have to work on that trunk control as well. So if they're from a further position back, they're able to really get in that trunk rotation as well. And again, you could always use the ball eventually through that pitching motion. And again, that was probably bad form, but you get what I'm saying about the ankle aspect.
I thought that looked great to me.
Oh, well, thanks.
We're going to call you up any day now. Okay, the next one is, can you address, and again, I hope I'm pronouncing it correctly, can you address strengthening the gastrocnemius tendon?
Yes, very good. So the gastroc, when I was kind of talking about earlier with the calf complex, and I know I really focused on the soleus, and I don't want to leave gastroc out. He's a big guy. So the gastroc, where I was talking about soleus just comes up to about here, but again, that powerhouse for endurance athletes, the gastroc comes up all the way and actually attaches above the knee. So not only does it work purely from really on that ankle strength, but it also has a little relation to the back of the knee integrity. So again, a very important muscle to work on strengthening by. And so if you wanted to focus more on the gastroc versus the soleus, you would do similar exercises, just with the knee tend to be a little straighter. So instead of having the knees nice and soft, you would have them straighter. And again, you could easily work on a nice controlled heel raise and working eventually with your ball of your foot on the step and working on your way down. But if you want to take that up a notch as well, say that would be pretty easy to work on the gastroc, you could eventually work on a single leg. And I think it's one of those things where we want to have balance in both. So, you may find yourself doing some with the knees bent, some with the knees straight, just so that you're working on both aspects of those two strong calf muscles.
Perfect. Thank you. The next question is, the heel and big toe, it's been hurting for a few months, especially in the morning, and I think it's plantar fasciitis. What do you recommend?
Oh gosh, well, I'm sorry you're going through that, and that is not a fun thing to deal with, and especially the fact that you mentioned that you're feeling it first thing in the morning. That tends to be kind of like a little red flag to us that says whoop whoop plantar fascia. Because when you think about it, when we're sleeping, usually our foot is in that kind of pointed or plantar flex position, which tends to make that the plantar fascia nice and tight. And so it sounds like you're having pain from here, right, as where the plantar fascia starts at that calcaneus and then comes up through here. And it actually spreads out to all the toes. So it's a very long piece of fascia. And fascia, while it's not a muscle, it's very dense and can still produce a lot of pain. But since it is fascia, it doesn't work in the same way as muscles, where muscles contract and relax. Fascia doesn't. It more so responds to some good tactile input. So again, going back to my good friend, the lacrosse ball or tennis ball, or one of my favorites, especially if it's painful, would be putting a plastic water bottle filled with water, put it in the freezer, or like a frozen juice can, and taking it out and sitting with your foot on the floor and really rolling through that, doing 3 to 5 minutes at a time. You can do it both in the morning and in the evening, just really working on that mobility. But also kind of thinking about some causes with plantar fasciitis. Some of that can be calf tightness, as well as decreased motion in the front of the joint. So, of course, working on that motion in the front of the joint. So kind of going back to that ankle mobility test, when you do that, you can see, okay, am I feeling that more in the front, or am I feeling more restriction in the back? And if it's the latter, I would then use your tennis or lacrosse ball to really roll out the calf and try to see if you can assess where those muscle knots are, just to make sure that it's nice and loose. Or you can even just simply use your hand or something like this. Athletes will use something called like the stick, and you can kind of find those muscle knots and really address them. And you can spend a couple of minutes at a time just not going to pain, just trying to get that good tissue mobility. And I often advise patients or athletes to do this after activity as well, as just assessing your own mobility and making sure that it's not painful. Just that way you're able to use those muscles better the next time you go around. And then if those really seem like those aren't helping, definitely important to either go to something like Ortho on Call or an established good care either with one of our orthopedic specialists or coming to physical therapy and seeing if we can kind of dive in and see what's going on to help you feel better.
Awesome. Thank you. The next question is, what are the best stretches and or exercises for perennial tendinitis?
Ooh, okay. So, perennials, we didn't hit on these much today, but let's discuss them. So, coming on the outside, so like I mentioned earlier, we've got the two big bones with at the top of the lower leg. We've got your tibia, then we've got your fibula. The peroneals start at the head of this bone, your fibula, they come down and they dive under here. So they're very long muscles. They're very thin. They're like half the width of your pinky finger, but there are 3 of them, and they really provide a lot of ankle stability on the outside. So I have a couple thoughts on that. So kind of thinking about the stability aspect, I would definitely work on some either single leg strengthening, or if that's too much to start with, if that's too painful, you can start with standing with one foot in front of the other and really trying to hold that position for 30 seconds at a time, trying to focus on that good stability. And of course, you can always switch feet, again, working on that stability. But then the peroneals also deal a lot with being able to accommodate uneven surfaces, and especially those with tilt. So depending on what you like to do, either for exercise or for fun, I'll see perennial tendinitis come up if someone is walking either on like prolonged gravel, that sort of thing, or if there's a tilt. Now, This is going to go against everything I usually say as a runner myself, because I feel like there are rules of the road that when you're walking or running, you want to make sure that you can always see the cars, of course, for safety, which I fully believe in. But you also have to think about if you have a lot of tilt to the road, either try to stay in the middle of the road where there's less tilt on either side, or if you're going to walk on the tilted road one way, come back the other way, make sure it's even. Just that way it's not just one side of the foot and ankle getting all that stress. Stretching, you can stretch them just by putting like a towel or a belt and gently stretching that way. It can be a little uncomfortable with that, but you could try that, or kind of similarly using like a stick, that sort of thing, gently rolling in there. But one of my favorite things too to help with that would be using something like kinesio tape or athletic tape, and putting it around the bottom of that bone, the fibula, and kind of pulling it up, kind of rotating, so my hand is the tape, and pulling it this way, providing that good stability to those tendons for when you're going to do a lot of activity, whether you're on a prolonged uneven surface, going out for a sporting activity. That way they're a little supported and unloaded. But again, there's nothing wrong with stretching it, but you may find better relief through those strengthening exercises and by using something like a kinesio tape or athletic tape around that bone on the outside, giving it a little support.
Perfect. Next question is, what do you suggest for preventing ankles from rolling while playing pickleball?
So, a couple different things. Definitely working on like going back to that ankle stability, and even kind of going back to what we were just talking about too, trying like the one foot in front of the other, working on the single leg stability. Research will show that if you are someone that has chronic ankle sprains, they often do recommend using something like an ASO, or which is just an ankle brace that crosses in the front to provide that stability. And again, that's research, which shows that, especially to prevent from rolling if you tend to be more chronic in that nature. Or going back to what I was saying a few minutes ago, even using kinesio tape or athletic tape on the outside of the ankle, that allows you to use your muscles more than the ASO brace, and it actually gives you that proprioceptive input. Proprioception meaning that connection between the muscles in your brain, and that way the tape would kind of tell you to not necessarily prevent rolling, but it would kind of tell you when it may, so you can use your own muscles to kick back into it. So either trying some of the stability exercises or a taping maneuver.
Okay, perfect. The next question is, what to do for Martin's neuroma?
Norton's?
That might be it. It might be a typo.
Yeah. So with that, you can definitely have a variety of different symptoms. Definitely check in with your orthopedic care team, especially a foot and ankle specialist. I know that can be exquisitely painful. Some people will use an orthotic in the bottom of the foot, whether that is kind of what I was mentioning earlier, either the arch rival, power step, but then they do have these little pads that are called just little metatarsal pads that you can put in the bottom of just your normal insert. If you think about like your tennis shoe, that it has the little insole in it that you can take that out, you would just be able to put the little met pad on top of that right where you have the Morton's neuroma to hopefully unload that space. And then again, I would definitely talk with your orthopedic care team, and you can try some gentle things, of course, foot and ankle stretching, working on that plantar fascia mobility, changing footwear. I would probably limit things that have like a high heel, thinking about how much that would really put that pressure in the front of the foot. But definitely check in with your orthopedic care team. I hope that feels better. No, that can be very painful.
It does sound painful. And it looks like our last question coming in is, any recommendation for general ankle strengthening for a 65-year-old with arthritis in the ankle joint? The joint can be very painful and unstable some days.
Oh gosh. Yes, indeed. I'm sure that is very painful. I would definitely work on some good daily mobility. Um, Whether, like we were kind of talking about with the ankle mobility test, if that is painful, kind of thinking about to the extent of the arthritis, you could try gentle calf stretching, either by standing, trying a gentle calf stretch with the foot that you're trying to stretch back, gently bending the front knee, stretching, holding 20, 30 seconds at a time, 3 to 4 times to work on that tissue lengthening. But also work on probably some good just general strengthening too. You can get a resistance band, a TheraBand, and work on the motions that we were talking about earlier, the dorsiflexion and plantar flexion. And so for the first one, you can have someone hold it. So say the band is around here, and then you're pulling up against resistance. So working on the strengthening that way, and then you can flip it around and you hold the resistance, working on that pressing on the gas pedal motion. And you can try probably 10 to 20 reps of those. That really works not only, of course, on the good mobility, but just good foundational strength. I could see where maybe the standing on one leg stability exercise might be a little painful, so you may benefit and feel more pain-free with the standing and with the one foot in front of the other. And you can always hold on if you feel unstable whatsoever, holding 20 to 30 seconds in one position and then switching your feet. So hopefully that helps a little bit, just trying to stay as mobile and as strong as you can with that. And you can always check in with your orthopedic care team. And again, if those things don't work, you can always you can always see a physical therapist and see if potentially an orthotic or an insert might be beneficial depending on your foot type.
Well, thank you so much. And that wrapped up our questions. And if we didn't get to your question today, be on the lookout for a blog where we answer all the ones that we weren't able to get to. So, Amanda, thank you so much.
Well, thank you all very much for having me today.